Good morning, everyone. I'm Rick Mullins. I'm the Executive Assistant to the President here at Central Connecticut State University, and I oversee the operations of the Institute of Technology and Business Development located in our downtown campus. So welcome to the downtown campus as well. We have with us today President Jack Miller from the university, and I would like to ask President Miller to come to the podium and make a few opening remarks. President Miller.
Thank you, Rick. Welcome to those of you that are here visiting and here speaking, and to those friends that come back at meeting after meeting. I thank you all for being here. I have to admit, honestly, I saw Rick a little while ago, and he said, "Oh, I didn't know you were coming this morning." And I said, "I didn't either, but I realized I hadn't come to one of these yet this year." So I decided, I looked on the schedule yesterday, and I said, I could go tomorrow morning. I'll go to that. So then I got here, and I said, geez, I wonder what they're going to talk about. So I'm not really very well prepared for the event. But when I found out what you're going to talk about, I said, good. At least while I'm here, I'm going to learn something about something I need to know a lot more about. So I appreciate the opportunity to be able to be here to hear part of this. Hopefully, it will prove to be something that all of you, certainly those of you that are more knowledgeable than I, will get benefit from. And I also would be remiss if I didn't thank all of the folks from CCSU, not only the group back in the back that are the people that put these on or help us to put them on, Rick for his directorship here at ITBD, which is excellent, Dr. Fearon for his work in moderating these things. So we appreciate your being here, and Rick, I thank you for the opportunity to say hello and welcome to all of you.
Thank you, President Miller. It's always wonderful to have you join us. Today is the third session of this year's Executive Breakfast Series. We've had two previous sessions, one in October and the other in February. Our first session dealt with social media, which was very well attended and had some great outcomes. Our second was on business valuation and helping small businesses understand what the value of their business is and how important it is from year to year to value your business so you understand what the assets are besides the capital and the facility and of course the human capital in your organization. When we started planning this session with our folks from TD Bank, who graciously have now funded this for a third year, and we're thankful for that, and they've also funded our University Center project for 2 years. And that center reaches out to small businesses and helps them with financial analysis, business planning, a host of a number of different issues. These breakfast series, working with TD Bank, we've looked for topics that are apropos. And if you recall, when we kicked this off last October, we talked about doing the Affordable Health Care Act towards the end of the session. The sessions being late in the spring. And the reason we did that is because the Affordable Health Care Act was being introduced in November on the national scene. And when President Obama was here at Central Connecticut State University, he talked about the excellent program that Connecticut has started in the affordable health care arena. And he talked about our program here in Connecticut being a model for the rest of the country. And if you've read the newspapers recently, you may have heard that just last week, the state announced that they had enrolled 208,301 people in the Affordable Health Care Act plan in Access Connecticut, which is remarkable. I think the target was around 100,000 individuals. And of course, we have an office right across the street here from ITBD. But what really makes these sessions special, and I'm not going to introduce the panel because Doc Fearon is going to do that, and what makes these sessions so special is the moderation by Dr. David Fearon from the CCSU School of Business, which, by the way, has been recently AACSB accredited, and we'll be celebrating that tomorrow night at the Convention Center. But Dr. Fearon has done a wonderful job from his perspective in management and organization in leading these panel sessions with provocative questions, dialogue, and summation. And so besides thanking the folks from TD Bank and asking them to stand for just one moment, so you can see the folks that are here on a regular basis and in our community that support us and support you, the business owners in the area. Thank you very much. I'd like to ask Professor David Huron to take the podium and kick our program off. David. Here.
First thing I want to point out is that the president of the University of Connecticut tried her best and was able to get Hillary Clinton last night. But President Miller has brought us Phil Boyle and Gerald O'Sullivan. Now that's really going good. In fact, I think the relevance of this session and their expertise ultimately is more meaningful to the future of Connecticut than perhaps the speculation of whether Mrs. Clinton will run again or not. So here we are. First, let me try to ground this conversation in something that I find to be most strategically important to the state of Connecticut. Let's look at this table. This is a workforce. This is a table representing what a small business needs every day, which is everyone on board, fully able to tackle the challenges of the day. And yet, we have an empty seat. And to me, this entire discussion is about this empty seat. This can be a 38-year-old woman who had critical duties to perform, but not her illness has taken her off from the day, but the illness of her uninsured mother. Not old enough to be on Medicaid, Medicare, refused access to Medicaid because she was making $2 more than the limit. Whatever the reason, she has to be there to take care of her mother. Each day that someone, either because of their own lack of insurance or the lack of insurance of someone about whom they care, is off the job, that's affecting the productivity of that company. We just learned that the middle class in the United States has sagged below Canada and the United Kingdom. Both those countries take care of their healthcare costs and treatments in a way different than we do. But what we'll learn today is at least we're moving toward the goal that everyone in this country, including the person in that chair and her loved ones, can work confidently knowing that if something happens to their health, they will be treated and they will not have debt for the rest of their lives as a result of that treatment. It's my pleasure then to introduce you to Phil Boyle and Gerald O'Sullivan, each experts in the issue of insuring the uninsured and making sure the rest of us through our businesses can stay well insured for the rest of our careers. Phil, let's start with you as introduction. What about that empty chair?
Well, thank you. Good morning, everybody. So that empty chair, my name is Phil Boyle. I'm the business-to-business outreach manager for Access Health Connecticut. But about that empty chair, well, now as of January 1st, 2014, all U.S. citizens are eligible and are required to have health insurance in this country. So to your point, if Mama, on that example, couldn't get the health insurance before the Affordable Care Act, she now can, either through assistance through us, through Access Health Connecticut, or on their own. But at least there's options now that there weren't before.
Mama worked for a business, the owners of which were uninformed and didn't care to be informed. She was working perhaps a little bit off the books. You reach out to these businesses. What is their legal responsibility to the people they employ, given our act?
So in terms of the legal responsibilities, the Depends on the size of the group, the employer, but generally speaking, the state of Connecticut, employers with 2 to 50 employees are considered small businesses.
Mhm.
I think it's section 38A-564, right? Yeah, exactly.
Oh, it definitely is.
I know, I'm a loser, I know these things. But anyhow, so any group that has 2 to 50, really, before the Affordable Care Act went into effect, and after the Affordable Care Act went into effect, have no responsibility whatsoever to offer their employees health insurance. What we've seen in the marketplace historically is small employers who want to be good citizens do offer their employees, and they want to keep their employees as part of their workforce.
Yes.
They do offer health insurance, but
Yes.
there's no penalty, there's no responsibility to do that. There has been a change in the law for groups with more than 50 employees, and it's actually, we've changed kind of the language that we're using now. So it's not full-time employees anymore, it's full-time equivalents, and I can get into that a little bit as well. But just for simplicity's sake, let's keep it 50 full-time employees. So if you have more than 50 full-time employees, there is a change in the law that says that if you have an employee that does end up coming to us as the exchange, Access Health Connecticut, and they get a subsidy, and that employer may, and I say that way, may be subject to a penalty. There are delays in that part of the law, and there are kind of some nuances in that part of the law, so it doesn't necessarily mean that they will receive that. But again, most small employers will not receive any type of penalty and will not have any responsibility to offer their employees insurance.
So it might have been the responsibility of the daughter to help a mother who is somewhat confused by all of this talk and the political rhetoric and so forth that was coming through since, well, for a long while. But there is an opportunity, and the more that we can, family members can be informed to help those who are working in those small businesses to find independent means of insuring, ultimately we're helping that business put her back in that chair.
Right.
What is the perspective, Jared, about the issue of this very large segment, particularly the greater New Britain area of businesses that don't have yet any legal responsibility to insure, and yet there's an opportunity for them to do so. And you represent the commission, but also you're tapped into the view of the insurers as to how much they want to reach out to particularly small businesses. So there's no question there, but the opportunity for you to talk about the empty chair.
Right. I just first wanted to say it's a pleasure to be here. My wife is actually a CCSU grad, so it's my pleasure to be here. I'm the Director of Consumer Affairs for the State of Connecticut Insurance Department, and just if you do take one thing out of this this session, is just there's somebody there, and we're actually statutorily charged to educate the public on insurance. Unfortunately, not enough people know we exist. We recover about $4 million a year for consumers in underpaid claims, denied claims that we overturn. And again, that's not just in health insurance, that's all types of insurance. And as small employers, you know when a person has a car accident, that can cause disruptions. So we can help out in those situations as well. It's just that we're there to assist. We're also there to give information. If you're looking for additional information, this is a great piece that I left up on the front desk, and it really does give a great overview of what the changes from the Affordable Care Act are. As Phil said before, and you said very well, the Affordable Care Act is a great thing for small employers, in my opinion, because again, you're trying to attract and maintain individuals who do a good job.
Right.
I was formerly a sales manager for an insurance company, so the agencies were small businesses, and they often lost their best people because they were going out to get benefits. Probably the most frequent phone call we received prior to the ACA was people calling up saying, can I get affordable health insurance? And unfortunately, they couldn't. If a person had even the most minor health issue, sometimes asthma, an insurance company would not underwrite them. So they would have to go to the group insurance venue where they weren't going to be underwritten to get coverage. Their only other option through Connecticut was what was called the Health Free Insurance Association, but it was incredibly expensive. The greatest thing about ACA, and the good thing for small businesses, is that people can go there, they can get those advanced premium tax credits, and again, one person's definition of affordable changes from person to person, but it is much more affordable now than it was in the past. And we always had a hard time in telling people this is where you go for affordable insurance. Now we just say you can go to the exchange and you can get affordable insurance based on your income. For the cities, and again, when we were looking at the numbers of enrollments and those types of things, a lot of that was very much so from those storefronts and the ones that we have in New Britain. You looked, when we were trying to make the best of the ACA, we were trying to reach the people who were uninsured.
Yeah.
And unfortunately, those are in the urban settings. We have a long way to go, and we were talking to one of the companies before this session. There's a lot of education that needs to be done for consumers who are new to the insurance program. What's a deductible? What's co-insurance? These are all new items for them, and we want these people to know that they can call the insurance department and we can educate them on what they need to know.
I think Gerard has touched on a number of points, but I think the critical one is until you are confident and informed to move into this very complex matter of health insurance, you're likely to stay out of it and maybe be in a state of denial. You say, well, I'll pay the fine, it's no big deal. In fact, I read something about some young people saying, oh, I think I'd rather risk the fine than to have to take on the burden of paying for health insurance. Strikes me that there's no one in this room who isn't paying for car insurance and probably knows the details of what deductibles mean and all the rest, because we've been living with it so long and we've been mandated for so long. You're penalized if you don't have it. But I want to get to the great story that Rick shared, Phil. Over 200,000 people. When did you see something really engage? What Phil just mentioned, Jared just mentioned the storefront. What's our secret to getting so many people, particularly in the urban areas, to get over that resistance or that denial, if you really need this, and starting to really take advantage?
So it was a success story. We've had received the accolades from around the country for our success. I think, as Rick said, the original number that we were supposed to reach on March 31st was 100,000. We had reached that number by, I believe it was January 29th. So the success comes from a multitude of ways. We, as a state, jumped right into this program. We did embrace it. We did make decisions right early on. We received support from a multitude of different organizations. The carriers just stepped right up. We did a twofold approach in terms of on the ground, or actually a threefold, I should say. So the broker community in the state of Connecticut, which across the country did not embrace this, did embrace it here in the state of Connecticut.
Big difference.
A big difference. They had seen that it was going to happen, so it was better to have a seat at the table and be participating than to kind of fight the fight, as it were. Mm-hmm. And it paid off for them, because the broker community brought in over 31% of our people who came in on the commercial or qualified health plans. We also had, to the point about inner city, we also had a navigator in-person assistance program. We knew that not everybody wanted to talk to a broker or see somebody who they didn't feel comfortable with. So we had people in the community, church organizations, people who spoke the language, just that people would feel comfortable with. So that was big. I was not a big fan of the storefronts, I'll be the first to admit it. This storefront across the street killed it. It's unbelievable. And that was the third floor.
All right, New Britain.
Yeah, exactly. And quite frankly, and you do have something to be proud of, we had one in New Britain and we had one in New Haven. New Britain outshone New Haven
like 10 to 1 or some crazy number. I don't know, don't know the exact number, but it was unbelievable, and so it was very successful. On top of that, we did, because because not everyone could make it to New Britain or New Haven, we did enrollment fairs around the state, and then those occurred in churches, schools, and all that. So it was just an unbelievable, and our marketing was just, the marketing did work. I mean, people really got on board with, we need this and we need to participate. And so twofold there. One was people who didn't have insurance knew that they needed to have insurance.
Yes.
And like I said, different organizations, the brokers, the carriers, the employers. The bottom line is we all know we pay for the insurance. So if somebody's uninsured, whether they're going to the New Britain Hospital for an emergency, you're paying for it one way or the other. The whole point of the Affordable Care Act, or one of the points is to slow down that system, right? So that people start to get health insurance or take care of their health earlier on, rather than waiting for the emergency room. So, going for preventative care, going for, labs and things like that, so they can find out that they can get better before they're in the emergency room. So,
And once in the emergency room, racking up the bills, they've also waited too long.
Exactly.
In the case of my own sister,
Yep.
who's right now hospitalized for waiting too long. So there's other more human costs that go along with that. Now what could have been prevented or at least early treated got worse. So there are a lot of things about that and about the person whose mom is in that situation. I'm curious though, Gerard, about the carrier side of this equation. I had heard, maybe read, that when this bill was being put out there and debated, that there was quite a bit of lobbying by the health insurance community, if you want to call them that, against this change, initially at least. Where is the carrier community now? You mentioned that quite a few signed on, but some didn't. Some of our own neighbor healthcare insurance companies have not yet signed on, as far as I know. So what's going on that side of the equation?
Right, I think the number one uncomfortable position for an insurance company is to deal with the unknown. They want to have...
They don't like the unknown?
Right, they want to have statistics, they want to have information, and this is a huge change as to, what are the costs going to be? And this is one of the big questions going forward. We don't know. We're only through, not even 4 months of this system where everybody can get insurance. There is no medical underwriting. So again, the companies were hesitant, but that was part of the negotiations for this. That was part of the requirement. If everybody's entitled to get insurance, then everybody needs to get insurance, because you would then have adverse selection. The sick people getting insurance and the healthy staying on the sidelines until they need it.
True.
So that was part of the way that this process would have to work, is that everybody would have to be in so that you have a big enough pool in sharing the finances of this.
Mm-hmm.
One of the things you had talked about before in getting this through to people, a lot of times it sells itself. A person who's uninsured, they're just one illness away from financial ruin.
That's right.
From bankruptcy. One of the best things about the ACA, and you talked about that as well, people waiting too long to get treatment. One of the best things about the Affordable Care Act is that preventative services are at no cost to individuals. So there are many things that people in the past had to pay a copay, co-insurance, it was part of their deductible. The laws have changed to get people to get the basic preventative services and get a healthier community. One of the things that was also put into place, which people need to be aware of, is the medical loss ratios. This was something in the past that the insurance companies were playing for the profits.
Sure.
And that's what a business does. The Affordable Care Act put into law that anything over, or they had to spend 80% or 80 cents on every dollar on claims costs.
Mm-hmm.
And as you business people know, actual costs 80%, administration, the salaries 20%. Those are tight dollar amounts that they're now under. And this is something that we're going to be looking at going forward. But again, this, in my opinion, being an insurance person, and the insurance companies as well are doing this, this is a first step. The insurance guidelines have been put into place. What needs to be done now is cost savings. And again, a lot of that will come from people getting the preventative treatment, not waiting to go to the emergency room and becoming unhealthy and racking up huge bills. So a lot of this has yet to be seen as to what the effects are going to be.
And I think on the other side, back to our empty chair, I think every business who has now people who are insured and have opportunity for preventive care are watching closely to see how their daily attendance is working, and it'll take some time to. Hopefully, you're tracking it. Someone who no longer is totally anxious about mama, because mama is insured, is going to be a more effective worker. Someone who finally is insured and comes to work for you until your business can take over that cost is going to be more creative, because they're not completely distracted by their health, as many people are. So I'm curious now, though, about the effect on the provider side of this, not the insurance side, but the provider side, because there are things happening now that you've been so successful, Phil, here in Connecticut, to our hospitals and other clinical settings that may be some learning curve for them as well. What are you picking up on so far?
So on the provider side, for our perspective, we engaged the different carriers, and it's been kind of an interesting thing because the major carriers, Anthem, Connecticut, United, have participated with us. And then we have created a new entity in the state of Connecticut called Healthy CT that didn't exist before. They are actually required under the law. We were required to have what is known as a co-op, and most people are old enough to remember mutual companies. That's what it really is. It's a mutual company owned by the owners of or the plan participants. We've also had another carrier come into the state that didn't exist before. Harvard Pilgrim opened up their doors about 6 months or so ago. So all those carriers are responsible for going out and engaging the provider community to participate in their plans. So they set the contracts. Our only requirement was that the provider contracts, or the providers in their carriers, be substantially similar, both inside the exchange and outside the exchange.
Right.
And to everything that I've seen, all the numbers, all the statistics, I'm not the number cruncher, that we've reached that. So every carrier has provided substantially the same. There might be a few carriers that don't have a provider here or there, but that quite frankly existed before the ACA.
Yes.
I was in the business world doing health insurance for 20 years. And as soon as those carrier network provider directories came out, they were out of date because doctors came and left.
But that's clearly one of the many concerns that the public had about moving in this direction. With required insurance now, would there be less participation? Let's say, is my doctor not going to refuse me now if I come in with this new insurance plan? There is adjusting to be done.
There definitely is adjusting to be done, but we know from, Massachusetts did this. They were as I always say, the little model before we built the big model, right?
Right.
So we know from the Massachusetts model, which was called the connector, or same terminology as the exchange, that, the sky didn't fall in, things didn't go crazy. There was additional waiting time, and Massachusetts has certainly a lot of doctors up there, a lot of physicians. But at the end of the day, the world didn't collapse. So, people were able to get in and see their doctors. And to Gerard's point, this is a brave new world, and we are seeing some adjustments. But I haven't heard of any, I haven't heard to date any lines going from, 30-day waits to 45-day waits or anything like that here in the state of Connecticut.
We're going to engage you in the audience at this point, if anyone wishes to pose a question. But I do want to underscore something that I didn't know, and I think we all should feel extremely proud about, and that is that Connecticut jumped in with both feet and did the job. Every part of the system, from the brokers to the providers, are in. Maybe not all in yet. Why we are the land of caution as well as steady habits, but we're in. And for the population that we serve and the FOIA employees that are represented by business in the state, I think that should be encouraging news. Wouldn't you agree, Jared? And are you picking up some little positives now for the Insurance Commission? Are people kind of saying, hey, good job? Or do we never do that to state employees?
No, we do, and of course, our phones have blown up with people who have questions.
Sure.
And again, you're adding. The idea was to get the uninsured insured, and that has ripple effects throughout the entire healthcare system. We already knew that there weren't enough physicians, and going forward, one of the universities in the state has opened up participating provider. PCP doctors in training, and that's something that going forward, we know that we're going to need more physicians to treat the people, give them the preventative benefits that are going forward.
Right.
As for the department, again, go to our website. We have a great deal of information on our website, not just stuff that's in Connecticut, but nationally. As you know, these laws are hundreds and hundreds of pages long. And a lot of times, because insurance is a state-based regulatory system, our laws conflicted with the ACA. So there was a lot of work that had to be done by our legal department, our life and health division, to go through our statutes and regulations and make sure that they work smoothly with the ACA. There's a lot of requirements now for strict review of rate increase requests by insurance companies. And again, this was something that Connecticut already did a great job on, but it's something that has a lot more focus, and we have every rate increase request received by a company on our website that people can go in and look at.
Wow. So the legislature also had to help out and participate in order to get this full court press. Phil, did you want to add something before I go to
I do, if I say please. So
Sure.
two things I'd like to add. First of all, I better compliment the Department of Insurance. And I say this because I go around the country, I mentioned the carriers and the brokers and all that, but our Department of Insurance is one of the premier departments across the country. There are states that really don't even have a Department of Insurance that's protecting their consumers, and we certainly have benefited from that because they do protect us. To Gerard's point earlier about the medical loss ratio, they kept an eye on our carriers even before the ACA and protected our consumers, so that's a good thing. The other thing I just did want to point out, because again, this is small employers that we're talking with, there's actually two kind of branches of our ACA, our exchange here in the state of Connecticut. If I may,
Sure,
indulge me
please.
for half a minute. So we talked about the 208,000 that came in as individuals, and that is great, and that is actually kind of how it did happen in Massachusetts. The individuals came in first and foremost. But we do also have a small business side of the Affordable Care Act here in the state of Connecticut called the SHOP. And that is a new program that is available to small businesses. I think you heard me say small businesses are 2 to 50. So small businesses 2 to 50 do get an option to come into our SHOP program. And in that program, it's a little bit different than the individual program. So on the individual side, we have Anthem, Connecticut, and Healthy CT that I mentioned. On the small business side, we offer Anthem, Healthy CT, and United Healthcare. And a small employer could offer their employees different options within that SHOP program. So one employee could take Anthem, another employee could take Healthy CT, and somebody else could take United, and the employer would receive one bill for that.
Wow.
And so that's a new program that's kind of pushed into the marketplace. The bottom line is we want competition in the marketplace as well, because when we have competition, we drive down pricing, right? So that's a good thing that's available now. So I do want to, we're very happy about that we've taken off on the 208,000, but we are now promoting this shop product that we have. And then the other thing, final thing that I'll say before, it's just, and you were making this point, back to Mama and the 38-year-old, what we call in the marketplace or in the industry, we call it, you know, a lot of people talk about absenteeism. That's what you're talking about?
Yes.
And really the ultimate thing is to get to what we call presenteeism. If somebody
I like
has,
that.
yeah, there you go. You can send me the quarter
You heard
every
it
time
here
you use it. You know, but every time that person, that daughter doesn't have to worry about mama having insurance, she is now at her desk, you know,
Yes.
working.
Yes.
And so for the businesses, that's a good thing.
Yes.
You know, so I'll shut up.
Well, is that SHOP? SHOP? Does that
Shop.
stand for
Yeah,
something? or-
it stands for Small Health Insurance Option Program.
Okay.
Yeah, I don't know how it ends up shop.
And I think that's, for me, as a person learning this, like some of us in this room, almost for the first time, shame on me for not paying more attention. That's very good news.
Yeah.
Because while we now have the momentum, and probably, you know, when we resume enrollments through the individual side, there'll be some more growth. But now we know that there's expertise available and companies ready to sell through SHOP.
Correct.
Excellent. Okay, questions, comments? Yes, sir.
Thank you. My name is Joe Harpy. I have a small consulting company and I consult to many businesses. And in my other life, I worked for Connecticut Development Authority. I was the chief lender for 16 and a half years. And most of the companies that we provided credit enhancements to, we didn't require it, but they did have health programs, either 100% or participated in the cost of the health program for their employees. So I think, you know, that was an excellent standard that a lot of states couldn't brag on, so to speak. But I have two questions. One is, there's some confusion in the marketplace, not picking on the president, but where he said, you know, if you want to keep your doctor, you can. If you want to keep your insurance, you can. There was a lot of confusion about that. And that led to a lot of companies saying, well, if I can reduce my costs and not provide any participation to insurance and kick it to the exchange, then I'll shift it to the exchange. So that's part of my question. Is that confusion cleared up? Because many companies, at least that I work with, don't understand that. And the second piece is, could you give us a quick overview of the platinum, bronze, whatever medal we're being awarded coverage? Thank you.
First, I want to point out how good it is to hear that the investment community looking at businesses want to see that their employees are going to be present. And so that's an interesting condition. Okay, you had two big questions here.
One of the parts of it was you were talking about keeping your plan and keeping your doctor. We did run into that quite a bit. Again, it was something that the president said, you know, you could keep that plan. Unfortunately, the insurance companies are also, you know, they have their free will as well. And the insurance companies decided that they didn't want to keep these plans. And that was a business decision that was made. And, you know, the president doesn't have any control over that. If the companies say, we no longer want to sell this plan, that's up to them from a business standpoint. Your issue on
Kicking it to the exchange. Yeah.
right, about people kicking everything else to the exchange, prior to ACA, there was no requirement for any business to offer any insurance. Now there is, you know, through some of these penalties for the larger employers. So actually the protection is more now than it was in the past, because, you know, some of them are going to be required. And you've seen those issues before, and that is something that as we go through, there was a delay in the penalties. So I'm sure, as we've seen with the very frequent and very last-minute changes in the individual program, we're going to see these changes in the group programs as well. And you want to talk about the medal?
Sure.
The medals.
The metal tiers, the infamous metal tiers. So, I'll give you two sides of this story, just as a kind of a little story as well. So people may or may not have heard, you know, we have platinum, gold, silver, bronze. So just a little side story. The CEO of our company, Access Health Connecticut, is Kevin Cunahan. So Kevin Coonihan, I referred to you earlier, there was the connector up in Massachusetts, a little model before they built the big model. And Kevin Coonihan was the chief marketing officer up at the connector up in Massachusetts.
Huh.
So Kevin was in charge of coming up with the names of the plans up in Massachusetts, and and of course you can imagine Massachusetts. So it's the Patriot Plan, the Minuteman Plan, one by day, two by night.
Bunker Hill.
Exactly right. So that's the thought pattern. And so, as is apt to happen, his wife got a hold of him and said, you're making this too complicated. The Olympics are happening. Just batch up the Olympics. Just go gold, bronze, silver, and all that. So that's how we got to the names, quite frankly. That's a true story. But really, simply put, the platinum, gold, bronze, silver plans are basically actuarial plans on it, and without getting too far into it, they're splitting down. So like a gold plan is an 80-20 plan, which means that a consumer would spend 20% of their out-of-pocket expenses, and the carrier would be responsible for the 80%, not including premiums. So it's the old, you can either spend additional premiums now and get more coverage, or you can go to a bronze plan, for example, which is a 60-40 split, spend a lot less out of your pocket, but would be responsible for more medical expenses by having that plan. Mm-hmm. Does that kind of make sense without going? I mean, I could spend 3 days talking about it.
Yeah. But
I think one of the
it is about how much, if you're an employer, how much you want to keep your worker from having to have less and less discretionary income, which then affects their morale and affects their ability to contribute to the business. So it ultimately is a business decision, as it is for an individual. How much do we want to contribute here so we can have a present workforce? Go ahead.
Just to add briefly, again, there's still choice in the marketplace. This is the exchange and the requirements in the exchange program. So outside of the exchange or off exchange, as they say, people still have those options that, whatever they want, they can build those programs to get them the insurance coverage they want for their employees.
Okay, Jack and then Tim. Jack?
No, go ahead. I have a question, so go ahead and finish answering.
No, I think he was done.
Mike, I'm not sure exactly how to word this question, and maybe it's just my total lack of understanding, but of any recent major changes I can think of in the government arena, I think this one is, to the naive observer, the most confusing as to whether or not it's going well or poorly. And we hear people who are in charge of or related to making it go well say it's a massive success. We hear, or another way maybe to put it is, if I turn on Fox News, it's the greatest failure of all time. If I turn on MSNBC, it's the greatest success of all times. If I look and listen and say, wow, we signed up 8 million people today, or up to today, and by the way, the secretary's fired. Almost at exactly the same time. So when you sit back and listen to it, you have no idea of whether or not it's working or not working, nor, and maybe this is the way to bring it down to a question, how are we supposed to understand what the goals are? Is 200,000 people of what? Is that, you can say it's great, maybe it's terrible. I mean, I don't know what it is of. I don't know what 8 million is of. If I talk about increasing the vote, I know how to count whether or not we've registered more voters. I know how to count what the turnout is out of registered voters, and if it goes up or if it goes down. But this, I have to say for myself, I don't know about others, I don't get it.
And I'll be brief so Phil can add his ideas as well, but I think you hit the nail right on the head. We don't know yet. It's the first minutes of a very long process. one of the things that, you know, a lot of people had asked for and we didn't have, and, you know, turning the clock back, it would have been great. How many people were uninsured and how many people are moving over from other plans? Those are things we would have liked to have known, and we're trying to get that information at this time as well. But I think the issue is that we have to wait and see. We don't know what the costs are going to be. As I said, we're in the first 4 months. How sick are the people who signed up? How much are the costs going to be? And as I said too, this is the first portion of it. This is the insurance portion of it. But this is about healthcare. And there's going to be changes to the models. If you go out into the Midwest, you know, there's systems where you go to one building and you go up and down and see, you know, your primary care physician, and you see the specialist, and you see everybody else. You get your tests all done there. We have a different model here in the Northeast where you go to the doctors that you want to go to. You know, it's going to have to change, and people are looking at that right now, looking at different models to bring these costs down and to make sure that going forward it does work. So in a short answer, it's too early yet to tell whether it's going well or not. I think it's going very well from a standpoint of how many people have signed up. A lot more data mining has to be done to see how many of these people were previously uninsured. But I think even that is overblown, because the people who were insured may have been underinsured. Their plans were much more expensive for them. They didn't have the preventative care. You know, the people who signed up, and you can keep your plan. I don't think people understood you might want to go to the new plan because you get many more benefits. So there's a lot to be done, and it's still yet to be seen. The only other thing that I wanted to say, the secretary resigned. She wasn't fired, so I just wanted to point that out.
So, health insurance is very complicated. And so we were, over the last probably 10 years, at a kind of a dividing point in the history of our health insurance. You know, costs were going up astronomically, especially here in the Northeast. Health insurance generally is expensive because healthcare is expensive. Mm-hmm. So if you look at the law, it is a big law, 2,000 plus pages. It's very complicated. I read a lot of it. I won't swear that I read every inch of that law, because when you got to the whereases and the therefores, I might have fallen asleep. But the law has three kind of elements to it, right? So the law has the health insurance that we all talk about, the premiums and such. But it also has parts of the law the second part of the law that kind of slows down the system, quite frankly. What is going on in our country and is happening kind of behind the scenes that many people don't know about, unless you're really engaged in the law, is the merging of hospital systems, right. Called accountable care organizations, ACOs. So your New Britain Hospital is now, you know, becoming part of Hartford Healthcare, and you know, they're all merging, and the part of that is for them to really kind of get control of the healthcare costs. And then the other thing, the third part of the law is about healthcare costs specifically. So you start to talk about value-based options in terms of purchasing. So does everybody have to have, you know, whatever, everybody have to go to the well to buy the same pen, you know, or can you know, that's probably a bad example, but the point is slowing down the system. We have been on a track in this country that has been going, you know, it's been off the tracks, quite frankly. We all knew that we had to do something. So this healthcare law is doing something. Is it the right or the wrong? To Gerard's point, all insurance is about history and volume. So this is, you know, 6 months into this, we don't know if this has been the right track at this point. That's for people probably smarter than me to figure out. But we're going in a new direction in this country, and it's the direction that we have because of the law.
Quickly to put it back to the chair and then to Tim, I do know that Mama had several pre-existing conditions. She had learned before the act that she was uninsurable. She'd been refused and refused, and now if she learns that her conditions would not be held against her in the process of acquiring insurance, she might feel different about that. But I think there's no one in this room who doesn't know someone who had a pre-existing condition. And particularly when they left the job, they were no longer insured. They had to go to the next job that employer finds out they can't insure that person. There are those kind of things that I think laymen like we also know from our own firsthand experience. Tim. Thanks for being patient.
Thank you. I think Jack hit the nail on the head too with the fear that people have in the marketplace. Anything mandated by the government is extremely scary to anybody, largely in our inner cities where many of our people come from other countries. That's a scary thought for a lot of these folks that have immigrated here. That being said, you mentioned something about hospital mergers and these big, huge conglomerates now taking over our medical care system. I mean, I think that's a slippery slope there, because you continue to talk about the unknown here, and we don't know how this thing is all going to play out. That's what scares people. It scares them the most, because we don't know. We don't know what the costs are going to be. Our cities and towns going to now see increased costs from their healthcare providers for the people that are guaranteed payers every single year, because we're insuring all of these uninsured people previously. Are those rates going to go through the roof? Well, they do every year anyways, you know, to the tune of 13 to 17% in increments, which is just unheard of. Now, you know, I think the unknown here is that going to be 23% next year and add costs to people that are paying taxes in your community? That's a scary thing. My question is, I had a discussion the other day with one of our local providers here of emergency services, and many of the patients they transport and provide services to, they end up having to write off a significant amount of those costs because these are uninsured people. And so I asked them, I said, aren't you trying to get them to sign up for the Affordable Care Act? I said, why not? Is the hospital doing it? And he said, no, they're not. And I said, well, why aren't they if it's a mandate? You know, if these people are being transported to hospitals receiving thousands and thousands of dollars worth of care, and you can't collect a penny on that because they're not insured people, even to go to Medicare, Medicaid route, which I think you're finding most of your uninsured people, the larger percentage of those people aren't picking plans, they're going into Medicare, Medicaid plans because they're eligible for that. But how do you get the providers now out there to be able to say to people, you don't have insurance? Well, here, you're signing up today. One of our navigators is housed here or what have you, and they're signing these people up guaranteed, so we don't put these providers like the emergency services people in our communities out of business.
Fear, definitely, of the unknown.
Yep.
But we are also in the Center for Entrepreneurial Development, so if you know it, then you can't make it new. But so we're in an entrepreneurial phase, clearly, as a nation now.
Yep.
And it's lots of reasons to be fearful of that unknown. But let's get specifically to the question of the responsibility of that hospital who's now, you know, eating those thousands of dollars.
Correct. So I you know, I had mentioned earlier, we're all paying for a rate for when somebody shows up at the emergency room, because, you know, the hospitals pass those costs along. So, but we did, so we took, you know, a multi-pronged approach to getting out into the community. So we, you know, we have our storefront across the way. We had navigators, in-person assisters out in the community. We also did have people at hospitals.